Hampstead Rehabilitation Centre is a specialist rehabilitation facility located 10 kilometres northeast of Adelaide CBD. Hampstead Spinal Injury Unit, also called Ward 2C and D, is the inpatient rehabilitation ward for the South Australian Spinal Cord Injury Service. It is the only inpatient spinal rehab unit in South Australia. If you are coming to Hampstead for rehab following a spinal cord injury, you will work with a team of health professionals to continue your recovery and to maximise your independence and abilities to get the very best out of life after injury. The members of the rehab team that may work with you includes doctors, nurses, occupational therapists, physiotherapists, social workers, a clinical psychologist and physical educators. Rehabilitation is different from being treated in an acute hospital. It is a combination of effort from the rehab professionals, you and your family or other significant people. You will be expected to actively participate in daily ward routines, which includes showering, dressing and going to education, therapy and gym sessions. Staff will support you to be as independent as possible in all these activities. Rehabilitation programs are tailored to each individual and your length of stay on the unit will reflect the rehab goals that are set with you. Your day at Hampstead will typically start with your personal care routine. The Spinal Injury Unit rehabilitation nurses will assist you with tasks such as showering and getting dressed. Managing continence and preventing skin-related problems will be a big focus of the nursing interactions with you. As you progress through your rehab program, nursing staff will help you to manage these aspects of your life as independently as you can by providing you with information and practical teaching for you and your family or carers. While you are on the unit, you'll be under the care of a doctor who has specialised in spinal cord injury medicine and rehabilitation. You may have already met your doctor at the Royal Adelaide Hospital. The medical team are available each day on the ward to deal with any medical problems you may have, and you can expect to see all of the doctors on their weekly medical round. Your doctor will also attend a family or discharge planning meeting with you. These meetings are a good chance to ask questions about your medical care and what to expect for the future. You will have a personalised schedule of therapy sessions during the day. Your physiotherapy program will be designed to help you become as independent as you can be with moving about and getting the most out of your arms and legs. This may include learning new ways to do things, training weak muscles, and practicing new techniques so you can do as much as possible for yourself. Depending on the level and severity of your injury, the kinds of goals you might work on with a physiotherapist include maintaining the range of movement in your arms and legs, strengthening those muscles that are active, controlling your balance and posture, learning ways of moving about, for example getting in and out of bed, the shower or a car. Most of this will happen in the physiotherapy gym, but you may also do some work in the hydrotherapy pool. Your occupational therapy program will be designed to maximise your independence with a range of everyday tasks such as showering, dressing, grooming, cooking, eating, shopping, using computers and accessing places in the community. Depending on your specific needs and goals, your occupational therapist may work with you to set you up in a wheelchair so that you are able to get around independently, help you learn new techniques or use aids and equipment to increase your independence in activities such as dressing, preparing meals or other household tasks. If your arms are affected, the occupational therapist may work with you to improve your ability to reach and grasp objects. They may also provide you with aids or splints to help you with tasks like eating or writing. Your occupational therapist may provide assessment and advice regarding modifications and equipment you may need at home. The occupational therapy department also houses a functional training unit with a kitchen, bathroom and bedroom set up to allow lifelike training of skills and also to allow overnight stays to practice your skills prior to being discharged home. The physical education department will design a program with you that complements your other therapies. The physical educators can set you up with a training program to increase the strength and endurance of your active muscles. This will help you perform other daily activities and prevent future injuries. The physical educators can also teach you to use a wheelchair safely and efficiently, teaching you the correct pushing techniques and how to control and handle a wheelchair over various terrain. The department also arranges various sport and recreation activities, such as wheelchair tennis and volleyball, and has close links with the Wheelchair Sports Association of South Australia. Driver assessment and training is also available. Hampstead Rehabilitation Centre has a vehicle fitted with adapted controls to allow assessment and training of people with a variety of disabilities. There are regular patient education sessions held on the ward, which you will be encouraged to attend. These cover a variety of topics, from understanding your body to taking care of yourself when you leave the unit. A community outing for patients is also arranged to practice your newly acquired skills. A clinical psychologist is available on the unit to provide support to patients and their families and assist you with issues that are common to spinal cord injury, such as stress management, pain management, and coping with treatment routines. The unit's social workers can assist you and your family with practical issues you may encounter, such as financial, legal, work, study, accommodation, personal care support, and access to community resources. Social workers can also provide a counselling service while you are an inpatient. The Paraquad Association of South Australia also has 2 peer advocates working on site in the spinal unit. The peer support advocates have personally experienced the trauma of spinal cord injury and the long-term process of healing and readjustment. They are available to talk with you on the ward and can provide some support after discharge. The spinal injury unit has 25 beds in single and double rooms. Each bed has its own phone which can receive calls, and you can make calls by purchasing a phone card. Mobile phones are permitted during non-therapy time. Each room has a TV and there is a DVD player on the ward for your use. You may bring in electrical equipment such as an electric shaver, laptop computer or PlayStation, but it must be checked by the Hampstead electrician before you can use it. This can be arranged once you are on the ward. Wireless internet connection is available free of charge. The ward has kitchenettes, including a microwave and fridge, which are shared between patients. There is a common meal area where you will be encouraged to eat your lunch and dinner. The ward also has laundry facilities for patients to wash their personal clothing. On the ward, you will be expected to wear day clothes rather than patient gowns. Loose-fitting clothes of stretch fabric, such as track pants and zip-front wind cheaters or shirts, are ideal to allow easy movement during your therapy sessions. Also bring supportive shoes. You may need them to be one size larger than normal to allow for swelling and to prevent pressure problems. Visiting hours are between 2:30pm and 8:30pm. Exceptions to this may be negotiated in advance with senior nursing staff. We also ask that visitors do not interrupt therapy sessions unless organised with the therapist beforehand. Hampstead Rehabilitation Centre has a range of other facilities available to its patients across the campus. QWERTY is an internet cafe open to all inpatients, outpatients and visitors of Hampstead Rehabilitation Centre. It is staffed by Paraquad SA staff and volunteers and provides free internet access and practical support for those who are new to computers. QWERTY also has assistive equipment to enable people with disabilities to use computers, including an infrared head mouse, joystick mouse and a range of keyboards. The Mule Shed is an informal space where you can drop in to work on a project of your choice or just have a cuppa and a chat with others. The activities available in the Mule Shed include carpentry, art, Wii games and other hobbies. Open Monday, Wednesday and Fridays, staff and volunteers are available to facilitate activities. You can watch what's happening or have a go at something you like. There is also a range of garden spaces and a mobility trail, which you can utilise during your stay, and a variety of other arts and recreation activities that happen on site. Prior to your arrival at Hampstead, a member of the Spinal Injury Unit rehab team will be allocated as your rehabilitation coordinator. Your rehab coordinator will be a key contact person between you and the rehab team and can act as your advocate. If you are in the Royal Adelaide Hospital, your rehab coordinator will visit you prior to your transfer and will be a familiar face on arrival at Hampstead. Your rehab coordinator will provide you with a handbook and other information sources during your stay, as well as giving you further orientation to the unit when you arrive. If you would like further information about coming to Hampstead, contact your rehabilitation coordinator or talk to your medical team.